All right, so for my functional goal, my patient needs to be able to don and doff a bra. I don't wear a bra, so I had to get some expert advice from my wife, and the patient is suffering from left shoulder internal rotation. And the goal of this exercise is strength. So we are going to focus on 6 to 8 reps of things, 3 to 4 sets. And then the patient is in the autonomous stage of learning. So she can do this without even thinking about it. And we're just trying to strengthen up those muscles so she can do it functionally. So with that, we are going to break down the motions that are required with putting on a bra. So we're going to clasp it in the front, which means we're adducting, internally rotating, which will be from the subscap, as well as the pec, anterior deltoid, and that's about it. And then we're going to switch it around, so that's still more of that internal rotation with a touch of shoulder flexion. And then slip the straps on, going into shoulder abduction, which will focus on middle delt. And then it's done. But then to take it off, we're going to have to reach around the back, which requires abduction, internal rotation, and then adduction once you're back here. And so then the patient will have to unclasp it, slip it off, which requires extension and flexion of the shoulder joint and off. So those are the motions. So first, to strengthen shoulder internal rotation, which is the functional goal of this, we're just going to do some simple band internal rotation. So I think my dog took my band. So here it is. So we're going to take this band, we're going to tie it around over here, and the patient is simply just going to do some internal rotation on that left side. Boom. Just like so. We're going to try to do 8 reps at a good amount for what she's doing. So I'd probably start with an orange or a green TheraBand because purple's pretty difficult. And so then once we're into that internal rotation, that's more of a functional goal. We can do isometrics if she so needs it. But again, we're focusing on that 6 to 8 reps. Hopefully, since she's autonomous, she's able to do strength training. Then we also need to focus on adduction, which will be in our frontal plane, as the internal rotation was in the transverse plane. So adduction, we're simply going to take that band and just pull it towards us. And since putting on a bra is more than the horizontal adduction plane, we can get a weight and just move it across the chest. So that's resistance with gravity. And we can also get a TheraBand and kind of punch to the side, so we're activating those pecs and anterior delt as well as the internal rotators. Just getting that really to move in that fashion because we need to clasp it in the center. So we can do functional movements with this. So we're going from internal rotation, adduction, and then for our sagittal plane, when we're putting on the straps, we're going into slight shoulder flexion. So we have to strengthen that flexion up. So we're simply just going to do some shoulder raises with some dumbbells. Now this isn't the most exciting routine, but it would be easy to do at home with simple weights or resistance bands that she can use while stepping on the ground and lifting up overhead. And she'd be able to do this every morning or every night as part of her routine. And it'd be easy for her not to have to compensate for that, given the proper resistance. But all of these are going to be within the 6 to 8 rep range to keep that strength factor, and about 3 to 4 sets, depending on what her tolerance is. Probably stick to 3 sets at the beginning. And then to finish... And then to finish this motion, we're going to focus on taking off the straps. So we're going to go to that subscap going back. It's almost like a manual muscle test. So even a stretch might be helpful, but since we're focusing on strength, just focus on that internal rotation is going to help. And so we can even add weight with resistance, have her turn to the side, whatever works for her. And then we're also going to need to work on abduction because there is a portion of abduction that she needs to go around. And so we can just do simply abduction, or we can even throw some D2 flexion in there with some weights. And then, of course, there is also the shoulder extension for that sagittal plane that we can throw in there. And other than that, those are the basic components of donning and doffing a bra. Obviously, as a male patient or male physical therapist, I can't personally go watch the patient put on and off her bra, but I can see how her muscles are functioning as a whole and see if she has any compensatory mechanisms when doing simple manual muscle tests or day-to-day tasks in the clinic, so I can help her strengthen those specific muscle groups like the shoulder internal rotators that she's struggling with. And if she's struggling with those, it might just be good to strengthen the whole rotator cuff as a whole with external rotation as well. And then possibly throw in some shoulder squeezes just to make sure that she's set in the right position throughout the day and not worsening her posture. So those are my 3 planes for putting on and taking off a bra.